Hello, Rob's Rebecca with more Napoleon Bisexual Emperor by Major General Frank Richardson, MD. We're at the start of Chapter 2, Napoleon and the Doctors. Doctors have differed about Napoleon's medical history ever since those. Let me put a book under here so it's not laying underneath. There we go. Doctors have differed about Napoleon's medical history ever since those who were present at the post-mortem examination of his body quarreled about whether his liver was enlarged or not. During his life, his medical attendants disagreed, as doctors will, about the diagnosis and treatment of his ailments, which may have helped to give him a poor opinion of the medical profession. He was himself such a master of detail and so interested in scientific studies that it is not surprising that he was irritated by the general air of mumbo-jumbo, the unscientific approach of many doctors of his day, and their differences of opinion about problems which he felt should have been resolved by exact scientific methods. He often complained to his doctors that medicine was a matter of uncertainty, conjecture, and opinion, and not an exact science. It was nevertheless a subject which fascinated him. In his youth, he studied anatomy, the precision and accuracy of which appealed to him, but he was too squeamish to make a success of such studies, and liked to relate how, when Dr. Covizar once unexpectedly placed in his hands a specimen of a human stomach, he promptly brought up the contents of his own. He was a generous and enlightened patron of science, and after the death of his little nephew Napoleon, he gave a prize for the best paper on the treatment of croup. Although ready to support and encourage medical research, he tended to expect that in return his doctors should be the instruments of his policy in public or private affairs, which, to their credit, some of them refused to become. Dr. Desgenetes, I should have looked these up, but I can't bother myself to do such a thing. Dr. Desgenetes' criticism of Napoleon about the poisoning of the cases of plague, to which I have already referred, was openly and vigorously expressed, and although Napoleon was great enough to respect honest and brave opposition, this could not be overlooked, and the temporary eclipse of Desgenetes left the field clear for the great Dominique Lowry to become the outstanding medical man in the Egyptian campaign. Amongst all his doctors, Napoleon had the highest regard for Larrey. Is it Larry or Larry? I'll just say Larry. But although he called him the most virtuous man he ever knew, he never really liked him, finding him too cold and reserved. It was a virtue in Napoleon's eyes to refrain from all kinds of opposition, and Larry qualified for high appreciation, for he was sycophantic and lost no opportunity to curry favor with anyone who could serve his own advancement, a time server, and a place seeker. Harsh words about an inspired surgeon who was devoted to surgery and the care of his patients, but André Soubiran's biography, though written in terms of idolatry, shows Lowry as grasping, self-advertising, never satisfied with the money given to him by his more senior patients, avid for patronage and recognition. He even solicited for the award of orders, such as the Russian Order of St. Vladimir. He was governed by self-interest in a way which today we would call unethical. We certainly hear of no quarrels with Napoleon, such as Sir James McGregor was ready to risk with his commander-in-chief, Wellington, in pursuit of the best conditions for British wounded soldiers. The great Albertonian McGregor was never a money grubber like the great Gascon Larrey. Dr. Jean-Nicolas Corvisart, Napoleon's principal family physician, opposed him in the more delicate field of his personal life by refusing to be a party to a fake pregnancy in order to provide him with a son and heir. The proposition was quickly dropped, and Corvisart promised to keep it a secret. But Napoleon ought to have known better than to have made such a suggestion to an eminent member of the medical profession, and the fact that he did so is one of many indications of his lack of true appreciation of the excellent doctors who served him so well. Corvisart, who remained a member of Marie Louise's household for a considerable time after her separation from Napoleon, was a sound physician with an international reputation as a pioneer in the diagnosis and treatment of diseases of the lungs and heart. Laennec, the inventor of the stethoscope, was his pupil. Napoleon liked to say that he had no confidence in medicine, but great confidence in Corvisart. Dr. Ivan, who accompanied Napoleon on all of his campaigns after 1796, was an excellent doctor, who understood his difficult patient perfectly. Halley and Boyer, who, with Corvisart and Ivan, were his principal personal physicians whilst he was emperor, were also prominent in their profession. Halley left the emperor after a violent scene with vague hints about having been subjected to some kind of personal indignity, which made it impossible for him to serve a man of the character which he discerned in Napoleon. All we know of this was that he had had his ears pulled, like so many others. He is known to have made a very frank report about Pauline Bonaparte's hysterical temperament, and this was at a time when the rumors about her incestuous relationships with Napoleon were being spread abroad, unjustifiably, as I believe. He was only bisexual. He wasn't an incestual creature. Napoleon and indeed all the Bonapartes must have been a gold mine to the medical profession. They were constantly popping off to spas to take cures for their many ailments, real or imaginary, for a tendency to hypochondria shows itself in various members of the family. For all that, Napoleon did not like people to be ill, and would say of anyone who was frequently ill, "Mais si un mazette qui si hamala." Sorry. It is true that Napoleon often expressed his appreciation of the services of his doctors, treated them well, and bestowed honors and rewards upon them. But his cruel streak prompted him to let them see that they were all quacks to him. He was no admirer of Voltaire, but would have agreed with his definition of medical treatment as the art of pouring drugs of which one knew nothing into a patient of whom one knew less. Expressing approval of the kind of medicine practiced in ancient Babylon, where the sick were exposed on the doorstep so that passersby could advise about the remedies which had benefited them, Napoleon remarked that with this method one could at least avoid remedies which had proved fatal. But wit was not one of his strong points, and doctors were usually the target for a feeble kind of banter, often with an underlying note of bitterness. "Well, doctor, how many patients have you killed today?" was a favorite opening shot. However, the doctors had the last laugh, and Napoleon's opinion of them could have sunk still lower, and with justification, if he could have seen them wrangling over his dead body, or heard the crop of macabre anecdotes on the imperial Caesar dead and turned to clay theme, to which their handling of the autopsy gave rise. One of these was told by Dr. Arnott, who helped at the autopsy, to Sir James Simpson, the Edinburgh obstetrician who pioneered the use of chloroform as an anesthetic. Arnott described his precautions to preserve the heart and other parts, as he was afraid that Napoleon's retainers would try to carry them off. He put them in a basin covered with water and lay down with loaded pistols under his pillow. Hearing a splash, he jumped up, but found it was only rats trying to get at the flesh. The unpleasant taste of such stories is relieved by the account of a British soldier who led his little son to where Napoleon was lying in state and told him to take a good look, as he had been the greatest man on earth. Napoleon's constitution and illnesses have been the subject of many articles in medical journals in various languages, and the influence of his medical history on his career has been studied in biographies written by doctors such as those by Augustin Cabanis, Boris Sokolov, Raoul Bryce, James Kemble, and Paul Hillemond. Mr. Kemble, an English surgeon, and most recently Dr. Hillemond, is it Hiller? Hillemond, have dealt so exhaustively with Napoleon's medical history that it is enough for me to concentrate upon those aspects of it which I believe can teach us something about his sex life or about the workings of his mind. Nowadays, few intelligent people are aware of the influence of the mind, particularly the unconscious mind, in causing illness. And such terms as neurotic, hysterical, psychosomatic, or emotional illness are widely understood. Such terms were not used in Napoleon's day, but ailments were sometimes described as nervous, rather as patients today will often say, "I think it must be my nerves, doctor." Napoleon is said to have been a nervous child, and he was volatile and excitable. I have already mentioned his violent outburst of rage, and though cold and hard-hearted, he wept readily. He often seemed unable to keep still, and during conferences or interviews he would dig chunks of wood and upholstery from the arms of his chair with a penknife. In the library of Edinburgh, I'm looking this fucking up right now, if it's Edinburgh. Alright, bruvs, apparently the proper pronunciation is Edinburgh. I think Edinburgh. Edinburgh. I think some people just roll the bra part and make it borough. The Library of Edinburgh University, a table used by Napoleon, has in it a small, smooth, rounded depression said to have been whittled by his penknife. When in a temper, he often smashed for... That's brilliant. When in a temper, he often smashed for... But even when not angry, he would fiddle with rare porcelain figures until he broke off arms and legs, whereupon he would scoff at those who were saddened at the sight of such damage, which he said a little glue would repair. Same thing my grandfather used to say. All this made people think that he had a curious mania for destruction, as well as nervous excitability. With such a temperament, many of his illnesses were naturally enough thought to have been nervous. Those who knew him well were aware of his liability to stomach upsets when things were not going smoothly, and the strange fits from which he suffered were also apt to occur at times of crisis or tension. The most notorious of these episodes was a convulsive seizure while he was in bed with the actress Mademoiselle George. And he never quite forgave her for arousing the palace in her alarm, for he hated to be made to look ridiculous, and on the occasion he most certainly was. Napoleon's fits ranged in severity from moments of abstraction, even transient loss of full consciousness, which puzzled and sometimes slightly scared the bystanders, and which call to mind a minor form of epilepsy known as petit mal, up to more serious and prolonged seizures accompanied by convulsions, which have led some authorities to support Corvisar's diagnosis that they were epileptic. Others have attributed the fits to a disorder of the pituitary gland, which lies just below the brain. Napoleon's pituitary will be discussed later in this chapter. I can't wait. Not unexpectedly, it has been thought that Napoleon's fits and his urinary disorders might have been the result of some form of venereal infection, for which I think there is insufficient evidence. Another suggestion is that some of the fits in which he lost consciousness could have been Stokes-Adams attacks, which are associated with heart block. In support of this is the fact that he had an abnormally slow pulse rate at 40 to the minute. Dr. Ivan, who from 1796 to 1814 was required to be in constant attendance on the emperor in the field, recognized and wrote about the nervous element in Napoleon's temperament. In a medical report written in Russia in 1812, Dr. Ivan said this: "The constitution of the emperor was highly nervous. He was very susceptible to emotional influences, and the spasm was ordinarily divided between the stomach and the bladder. When the irritation affected the stomach, he had a nervous cough which exhausted his emotional and physical forces to such an extent that his mind was not the same. The bladder ordinarily shared the spasm, and he then found himself under an influence both painful and fatiguing. Napoleon often said, "I live only by the skin." His doctors confirmed this and explained that the hot baths in which he spent so much time helped the functioning of his skin. Dr. Ivan, writing about Napoleon's dependence on his skin, had this to say: "As soon as his pores were contracted from either an emotional or an atmospheric cause, the appearance of irritation was manifested, with a result more or less serious, and the cough or achuria became pronounced. All these manifestations ceased with the re-establishment of the function of the skin." Napoleon's nervous achuria, difficulty in passing water, will be dealt with in Chapter 4. Dr. Ivan was rather ahead of his time in recognizing that Napoleon's frequent skin disorders were one of his nervous or emotional troubles. Realization that the skin is just another organ of the body which responds to emotional tension has grown considerable in recent years. It has, of course, been known for a long time that the tiny blood vessels in the skin and the sweating apparatus controlled by the sympathetic nervous system react to emotional stress. We grow pale with shock, redden with shame or embarrassment, sweat with fear. Witch doctors have taken advantage of the cold, wet palms of emotional tension and anxiety to detect offenders. The pimply face of adolescence, notwithstanding the influence of hormones from the developing sex glands, may be also a manifestation of the anxiety associated with the difficulties of growing up, and suggestions, whether joking or serious, that such conditions are due to not washing or to impure blood, whatever that may mean, merely aggravate the anxiety and make matters worse. Probably not even ignorant headmasters any longer hint that they are due to masturbation, to which, incidentally, Louis Way, in Adler's Place in Psychology, tells us Napoleon was said to resort for the relief of tension before a battle. "Hey, let me jack it before I go fucking murder some people. Wee wee! Touch me wee wee!" For many years before he met Dr. Ivan, Napoleon suffered from an intractable skin disease which was diagnosed as scabies. He himself always said that it was caused by handling an infected ramrod at the siege of Toulon, a typical example of the tall stories which soldiers sometimes expect their medical officers to swallow, though there is no reason to think that Napoleon did not himself believe it. Mr. Kemble considers that Napoleon suffered from neurodermatitis, which is described in textbooks as resulting from chronic scratching of the skin under the stress and anxiety of emotional conflict, arising particularly from social or sexual problems. Now, it was in 1799 by no means a smoothly successful year for Napoleon, until his coup d'etat in early November, the coup de Brumaire, that we hear of him scratching at the pimples on his face so fiercely that his face was covered with blood, and his soldiers thought that he had been wounded. His valet Constant recorded that at Fontainebleau, before his departure to Elba, Napoleon's agitation actually reached such a pitch that on several occasions I saw him dig his nails into his thigh so vehemently that the blood came, though he did so without noticing it. He had some kind of sinus on his thigh, probably resulting from a wound at the siege of Toulon, at which he would tear in moments of stress, and when the blood flowed, he felt physical and mental relief. Dr. Anton Marchi, who was the first Antomarchi, who was his last personal doctor in St. Helena, described one such episode. "Thanks, doctor," he said. "I have something better than your pharmacy. The moment approaches I feel nature will relieve herself." In saying this, he threw himself upon a chair, and seizing his left thigh, tore it open with a kind of eager delight. His scars opened anew, and the blood gushed out. Kemble says that there were other parts of his body where he chose to open a vent for the bad humors, as he imagined. Kemble sees this as another example of his neurodermatitis. His valet Marchand related how in Elba Napoleon used to talk to Dr. Fourreau de Beauregard about his habit of scratching at these places on his body until they bled. He regarded this habit as a therapeutic one equivalent to the practice of bleeding, and he knew in advance when crises of this sort were approaching. These strange practices recall the description of the feeling of bursting, of surface tension. Of surface tension and the internal pressure, which the controversial psychologist Wilhelm Reich associated with failure to achieve perfect sexual adjustment. Another physical sign of Napoleon's unquiet mind was the muscular twitching affecting different parts of his body, which was written about by a great many contemporary observers, including de Bourrienne, who wrote, "He frequently gave an involuntary shrug of his right shoulder, which was accompanied by a movement of his mouth from left to right. This habit was always most noticeable when his mind was absorbed in the consideration of any profound subject. Such involuntary movements are called tics, or habit spasms, and are a motor manifestation of psychological tension. Lord Morin called them the certain badge of nervous tension. Dr. Cabanis, the French author of many medical studies of great men in history, has compiled from a wide range of close observers of Napoleon a most formidable list of his nervous habits, twitchings, jerkings, nail biting, and emotional outbursts of rage or weeping, and whacking it on the battlefield. Under the heading of tics, he also gives a great many eyewitnesses' accounts of Napoleon's habit of grasping his soldiers' nose. Come here, little fucker. And of tweaking, maybe it was the original Three Stooges. And of tweaking, pinching, and slapping men, women, and children. These are not properly referred to as tics, and I will discuss them when dealing with the sadistic element in his nature. There is abundant evidence to support Dr. Avant's opinion that Napoleon was of a nervous temperament, and that many of his illnesses were, as we would express it today, psychosomatic or emotional, being physical manifestations of a failure to achieve perfect adjustment to the demands of the sexual instinct. So he's just slapping the shit out of random people because he can't fucking... What's the perfect adjustment to the demands of the sexual instinct? What's that mean? So anytime you fail at sex, you just slap people and grab their noses? What the fuck kind of talk is this? Before discussing the psychological aspect of the case, we must complete our physical examination by taking a look at some of the post-mortem findings. This will at once plunge us into another of the whirlpools of conflicting opinion, which revolve perpetually around almost every aspect of Napoleon's history, but it will also throw an interesting spotlight upon his sexual problems. Considering the hit-or-miss methods of diagnosis and the undeveloped state of medical science in Napoleon's day, it is understandable that there should have been disagreements about whether he was epileptic, tuberculosis, the victim of stones in the bladder, that would sound like it, or of some other form of urinary disorder, and whether a skin disease was scabies or not. But it is a little surprising that there should have been disagreement about the cause of his death. The arguments begun in St. Helena in 1820, or is it Helena? In 1820 continued to this day. His unexpected death shocked countless Frenchmen who felt that his body must be imperishable as his name. Murder by various means was freely alleged, and in 1962, a Swedish dental surgeon, Sten Forshavod, revived the theory that Napoleon was poisoned by arsenic, possibly by de Montfaucon. Forshavod failed to make many converts, and the most popular diagnosis is still the one made at the post-mortem examination, that Napoleon died of cancer of the stomach. However, the views of a formidable list of experts who have been unable to accept this theory emboldened the American author Ralph Korngold, 1960, to state that it is accepted by most modern pathologists that Napoleon did not die of cancer. The most probable alternative diagnosis is a liver abscess resulting from intestinal and hepatic amoebiasis. hepatic amoebiasis, protozoal infection, which was almost certainly endemic in St. Helena at the time. Since this chapter is designed to explore Napoleon's mental or emotional makeup, the precise cause of his death is of minor importance, but one apparently bizarre theory is interesting. This is that Napoleon died of boredom, which was first suggested by Las Casas in 1823 and revived in a letter to the Times 11th December 1962 by Mons. Gilbert Martineau, the French consul in St. Helena. Whilst he was in Elba, Napoleon had written, "On a small island, once one has set the mechanism going, nothing is left but to die of boredom, and in some heroic venture to escape from it." Is death from boredom possible? Recent descriptions of the so-called gold watch syndrome, due to the boredom of retirement, hint that it may be. I mean, every teenager would be dead because they're all bored all the time. That highly lethal condition beloved of filmmakers, absence of the will to live, really can be a factor in the progress of illness. As an experienced surgeon recently put it, it is a well-known thing that some Orientals can and do simply turn their faces to the wall and die, and that there is nothing yet in medical science that can prevent them. In a report of a clinical pathological conference about a very difficult case of adult celiac disease, I think that's what that is, British Medical Journal, 15th June 1968, the family doctor, dissenting from the views of the learned consultants, traced the psychosomatic influences in his patient's life and concluded, "I feel that he died because all that he lived for had somehow come to nothing." How exactly this fits Napoleon, his worst enemy, could hardly fail to be moved by the pathos of a remark which he made to General Gourgaud, who had been grumbling about the intolerable ennui of life in St. Helena. "Do you think that I have no bad moments when I lie awake at night and think what I was and what I am?" And now for the spotlight which Napoleon's dead body can direct into the hidden recesses of his sexual difficulties. Post-mortem examinations have usually little to contribute to psychiatry, which must deal with the living troubled mind. But in Napoleon's case, we can learn from his body something about the doubts which must have afflicted his mind. Antomarchi may have been an indifferent doctor, but as a former prosector, or assistant to the professor of anatomy in Florence, he was at least qualified to perform the postmortem examination, which he did in the presence of 7 British doctors. But even here he failed, not Napoleon, who was now mercifully immune from his mishandling, but posterity. From an anatomist, we might expect precise details of Napoleon's external appearance to supplement the many descriptions of his physique by contemporary observers and the evidence of portraits and sketches. He made an exact measurement of Napoleon's height, and this is discussed in Chapter 3. But apart from this and some craniological rubbish about organs of conquest and of ambition and love of glory, we are fobbed off with the tantalizing comment that the hands and feet were rather small, and all other parts of the body were nearly in the ordinary proportions. From an anatomist, that nearly is not quite good enough. Fortunately, Audemars' deficiency was to some extent remedied by the British Army surgeon, Walter Henry, who seems to have been the only one among those present fully to comprehend the historical importance and interest to posterity of the scene at which they were assisting. In his memoirs, Henry veiled some, or is it Henri, veiled some significant details in Latin. I'm not even going to attempt that. Partus viros exiguitatis insignis sicit pueri vita banter. The private parts were seen to be remarkably small, like a boy's. He might have been less direct, less discreet if he had known about the body language in which Napoleon's physical shortcomings had been described by some of his generals and soldiers, and even by his beloved Josephine. However, Henry also made a straightforward medical report for the governor, which had been printed in at least 2 books intended for the general reader, but is probably little known. An extract from it, which has a bearing on Napoleon's sex life, is reproduced here. The whole surface of the body was deeply covered in fat. Over the sternum, breastbone, where generally the bone is very superficial, the fat was upwards of an inch deep, and an inch and a half or 2 inches on the abdomen. The skin was noticed to be very white and delicate, and were the hands and arms. Indeed, the whole body was slender and effeminate. There was scarcely any hair on the body, and that of the head was fine and silky. The pubis much resembled the mons veneris in women. The muscles of the chest were small, and the shoulders narrow, and the hips wide. The penis and testicles were very small, and the whole genital system seemed to exhibit a physical cause for the absence of sexual desire and the chastity which has been stated to have characterized the deceased. I thought he was fucking everyone. Or are they just talking about on the island? Anyway, I'm going to stop here because I'm at 31 minutes and I'm never going to finish this chapter anyway. So that's that. Until next time, goodbye, bros. Goodbye.